Good morning, everybody. It is Matt.
Hi.
And Dyan with a microphone. Welcome back to OK Aussie.
You're welcome.
It's always a dangerous sign when someone's given her a mic. Are you on your soapbox?
I'm on my soapbox.
Right. Why are you on a soapbox?
Well, you invited me here. Thank you for inviting me here.
You live here. So do I.
Yeah, I do that
Indeed,
as well.
yes.
I do live here.
Yeah.
But since having a date with Hugh Grant, I seem to be in demand.
So
It was a dream.
I've got to say, did I miss
Didn't happen
something?
in
When did
real
that
life,
happen?
As if.
Right.
Okay.
Okay.
And of course, no, I've already got a husband, so I'm not allowed to have another one.
Well, multiple, no. Not on my watch, anyway. Anyway, guys, welcome back
I'm
to
in
the
demand.
channel. She's demanding or in demand? Which one is it?
Both.
Both, okay. As long as we've clarified that, that's the main thing. It is a Sunday morning here in Perth, Western Australia. Sunny. It's on the way to what? It's 26 degrees outside. It's on the way to 37 degrees tomorrow. How are you going to go with that?
Yeah, not liking it.
Not liking
Well,
it.
actually, I like it.
And that's Celsius, by the way.
I like it. My spirit likes it, but my body goes, nah.
Yeah, the internal computer system says
So there's a bit of an
no.
argument. My
Right.
spirit goes, fuck you, body. And my body goes, sorry, but you're broken. Suffer.
Right, well, we're going to talk about one aspect of that brokenness
It's a drama.
today in today's conversation.
Yeah.
For those who are new to the channel, welcome. Don't forget to subscribe and hit that notification bell. Dyan is a person with disability. She has a chronic chromosomal disorder called 22q11.2 deletion syndrome.
Otherwise known as Did George. And did you know
Yes.
that it's a very sad story to tell, especially because of this 22QR, Did George child had to suffer a lot. But Russell Brand's son has Did George.
Okay.
And
I didn't know that.
had open heart surgery very early as a baby.
Right, very common.
So this is a very serious condition, and I just want to make sure people know that.
Well, particularly when it comes down to heart, we're actually going to talk about the heart
Funny
for
that
you
we
with
actually talk about the heart.
complex condition, but also just in general for females in the Australian health system. Because did you know that it's actually four times more likely that females will have a heart issue that'll go undetected, unsupported, or delayed in discovery and treatment.
And did you know
National Heart Foundation,
that the stats have not changed since the 1990s?
Yeah, now you said Did George. Was other names for this
That's
condition?
the old name. The new name is 22q. If you want the latest research, you must search
I'm glad you
22q
clarified that.
11.2 deletion
Because that's
syndrome.
genetics. That's the involvement of the condition.
No, but I'm just saying, if you don't know, see, when you go to university, there is a wonderful thing you get taught, which is how to research. And I'm not trying to say this I'm autistic, I'm blunt. But it's a
blunt.
tip here. If you have not had the privilege of going to university, when you research on Googs, okay, the Googs, we need to always use the right definitions.
The nomenclature, the naming conventions for...
the culture of whatever the name of whatever you're looking up is. So I'm just clarifying that. If you want the latest research, cutting edge research on this syndrome, you must type in the full...
It is. Now, this syndrome actually used to be encompassed by many names, not just Did George, velocardiofacial syndrome,
And that's going back again and again and again.
And there's other
and
variations,
again.
probably about 12 different, including Catch-22, our favourite one.
It's not my favourite. Not my favourite.
I think it's
Because I'm always in a Catch-22.
You are.
So it's not my favourite.
But it's very synonymous with the syndrome 22q.
It's favourite. It's not my
No,
favourite.
it's not like that at all. So, unfortunately, the other part to this, which a lot of people don't know, is the statistics for this condition are actually pretty poor. And in fact, there are many children who, before even birth, unfortunately, are affected or impacted by this condition, commonly with congenital heart-related issues.
When a baby is in the NICU, okay, this is, I deal with nurses, you know this. I know in my state that they would do and have done, and particularly in my days in the 70s, they would do resus and CPR on the babies and not tell the parents.
Yeah. Okay, I get that. A lot of things, unfortunately, are hidden and not actually communicated, but that's yet another sort of drama around this. Anyway, now, I want to talk about heart specifically, because that's just one of the aspects. So with this 22q, you've got a micro deletion.
Yeah, but it's the dangerous aspect, and the reason why the focus of that for me, is my biggest focus of my health, is because it's the big killer.
Absolutely. So let's talk about that first. There's 185 clinical symptoms that go with this condition.
41.
Yep.
Due to cardiac. So, of course, I have to be on the lookout. And
so the number one cause for your genetic condition of mortality is actually a cardiac related.
Without symptoms.
Yep. Or without having specific congenital issues, you can suddenly come on, or things can change, which is why the clinical guidelines, the international clinical guidelines,
you were born with congenital
actually expect you to be monitored yearly. Okay. Your rheumatologist on another, I'm going to jump a little bit here because this umbrella 22q actually encompasses 185 clinical syndromes. One of those is the hypermobility Ehlers-Danlos. What did your rheumatologist? Another specialist? You're under 25 different specialists. What did your rheumatologist say? How often do you need to be under cardiac review by the cardiology team?
I think he wanted it every 2 years.
It's actually 3 years. Every 3 years.
She said when I got to my cardiologist, I tried to keep to the same one that I always had, like, from 20 years ago.
Yeah.
She wanted to see me every 4 years, though.
Sure, yeah.
But you're saying we're recommended is 3. So, no, we paid for her.
Yeah, I understand.
She's already getting enough money, obviously.
Now, the other part to that is the clinical guidelines do actually specify that cardiology should have annual reviews because things can change. Aortic valve dilation can actually occur. That's one of the big things.
When you have symptoms like myself, when you have a heart showing things and oxygen.
Well, this is why we have the pulse oximetry.
That's when you need intervention from a cardiologist.
So we're going to talk about some of those things in today's episode. So stay tuned because this is not just also specific to Dyan. It's actually very important for you to understand the perspective and what's impacting
the aging side of 22q. So 100%. If you have been blessed, like I have, to survive birth, to survive 3, to survive childhood, teenage, because when I was a teenager, I nearly died from glandular fever. I nearly died from glandular fever. Okay, so we are so susceptible, just like a cancer patient, to just getting something and just not coping with it because of our underlying pre-existing condition, which is 22q. So I've made it to adulthood. That's fantastic.
And that's very lucky because not all do.
I didn't get told early, so I haven't grown up with the knowledge knowing I only really have a survival rate half of my peers of the time on this earth as my peers. That's a shock. And second to that, I have had heart symptoms since 32.
Absolutely. And I do remember when that first came on board, your cardiologist, even in the early days, said, look, you're most likely going to need to have a pacemaker put in. The medications may and probably won't work with you. And they actually said at the time, a person with this sort of condition is likely to have some sort of really
can you say medical
underlying genetic condition. Did they search for that? Did they look for that? No, they didn't at the time. So Dyan is late diagnosed at 48 years of age with a condition where she's presented 1,000 times.
Oh, I've presented. I've explained my symptoms, been called anxious and all of that nonsense.
Let's talk about that in a moment too.
I'd love to go back and say,
and now what?
Read what I've got?
And what you missed?
From a geneticist is 99.98% accurate.
I know, right?
Can you apologise now?
Now,
because you were a biatch.
Now, the actual condition that Dyan's got 22q basically means it's a micro deletion on the long arm of the 22nd chromosome. We have 23 pairs of chromosome. You're missing between 30 to 50 genes. 3 million DNA building blocks, okay? And a lot of it is midline related. And of course, what's affected in the midline? The heart comes into this play. Okay. But let's take a step away from your specific condition. Just want to share some facts and information which is very pertinent. Women in general, and particularly in Australia, this is the National Heart Foundation's also saying this, women in general are not being diagnosed with heart failure as often as they should be.
Damn straight.
Why? Are they not worthy?
Shame on you.
Are they different, perhaps?
I hope your wedding was great, but I tell you what, you've got some things to fix, Mr.
Albanese.
Okay. We keep changing Prime Ministers so often.
That's our Prime Minister. And you say wedding because he had his
It's like some of my friends' boyfriends. It's like, oh, how's so-and-so? I know that no, remember I'm with someone. Oh, sorry.
Autistic FUPA, honey, you need to keep up.
Oh,
so let's try and focus on this with your ADHD.
With
so women are not being diagnosed with heart failure as often as they should be due to a combination of factors. Now that includes symptoms that are often vaguer or different from classic chest pain, a historical perception of heart disease as being a male disease.
Not a male disease. No, let me just clarify for the lay people here that the doctors, they're not going to be honest. You are just as likely as a man to get a heart attack or stroke, ladies.
Do you have a heart?
Please understand, we all have a heart.
This is like
do you have a heart? Yes, we have a heart.
Wizard of Oz, do you have a heart?
But I'm just saying, do not believe the bullshit women that you are less likely to have a heart attack or stroke. You're not.
No. Now, also, the diagnostic criteria can be a little bit less accurate for women. No, really?
Can I say why?
Of course you can,
just like autism, all of the studies were done on males.
Funny about that.
All of the studies on heart.
Statistics.
Males.
Data.
They don't have the stats on us.
Boom, yeah. Now, did you know there's also no longitudinal studies? She's been waiting to do that. There's no longitudinal studies for patients with 22q above the age of 30 years of age.
Are they all dead?
30 years of age. Well, have they been able to find them? Are they all dead?
That's not even funny.
Is that many? I know. But this is also really relevant because we don't have enough data to support what's actually going on.
Well, we know what's going on with me.
Now, additionally, women are sometimes less likely to seek immediate care. And there may be a lack of provider education on sex-specific differences in cardiovascular. What's even more true for you, and particularly not just because of 22q, because you're autistic.
And also, when you get gaslit, like when I had the arrhythmia.
Misogyny.
5 minutes before the arrhythmia and the white coats all came in.
Yeah.
Don't stress.
Yeah.
Stay calm.
Stay calm.
I'm like, well, you did a fucked up job of that.
Yeah.
Because you've just sent 10 doctors
racing
around me and it's resus.
Oh, not another Met call.
I'm thinking, am I already dead? And I'm just sitting here thinking I'm all good. And they're all... Anyway, 5 minutes before that, this is the treatment I got. Sweet. Actually, listen, hang on, let me do it properly. I'm
please do it properly.
Too sarcastic there. Got too sarcastic.
Calm the sarcasm down, yep. So this is an ED
base.
sociopath,
you know. Oh, sweet.
Yes, doctor?
Are you having any stresses at home?
No, doctor. Why do you ask?
Are you sure?
Yes, doctor.
That was it.
That was it.
That was what, and I was like, don't touch me, first off. Second,
as an autistic, don't touch me.
I'm thinking, I'm
back
going
away.
through all the stresses. I'm thinking, what? Waking up to lots of dishes because my lazy children who live at home still don't do their dishes.
So you go through the literal list.
Is that what you want to hear? Because I'm happy to tell you. And my youngest son, he's just like me.
Okay.
His room is a bomb.
Refocus the ADHD.
A bomb went off in that room.
Focus.
And I walk in and it stinks.
Okay.
And it takes me an hour and a half to clean one room.
Okay.
Is that stress you want to know, sweetie? No.
So you had a female doctor really condescendingly talking down to you
boys,
to say...
it's not your fault. You're normal.
Let's refocus.
Sorry.
A female doctor was condescendingly saying, you must be just anxious, darling.
I think she was hinting at that, yes.
Now,
I'm a bit autistic
here's the interesting part of that actual scenario. The thing that they did do, they did put the ECG, electrocardiogram dots on Dyan to do one trace report. That's a 10-second grab in that 10-second moment of time to say, oh, look, your heart's perfectly fine. In fact, they're actually bundling up Dyan to say, we're just going to get a nurse in to take your cannula out, honey, and you can go home. You're okay. Do you know how many times I've heard, you're okay? Okay, well, let's listen to that for a moment. So here's Matt, because Matt spent most of my life sitting in ED with this one.
Yes, sadly.
To the ridiculous hours of the night, watching all the monitors and the beeps. And you learn. You really do learn.
Calculate that ready for court.
Yeah, okay. But what I was noticing with the graph that goes across was that your QT spike was irregular and was irregular in rhythm and also was longitudinal and
because you kept
missing.
Asking me, is your chest tight
I'm asking
now?
what's going on. Oh, shit.
Normal for me right now.
Okay, this is just in context to what we're talking about.
Oh, for goodness sake, stop being so dramatic, huh? I'm just having a chat.
Dyan's oxygen is 92. Heart rate is 126. Can you see this? Of what's going on? She's gone tachycardic.
All right.
And she's just sitting quietly relaxed. So anyway, the alarm's going to go off.
So,
but I was watching these monitors. I also then took a video because, you know what? I'm thinking,
is it tight? Is it released? In conjunction with looking at the monitor. I couldn't see the monitor because I'm facing this way. The monitor's behind me.
Sorry, I've just got to keep an eye on your monitor. Are you feeling okay breathing-wise? Because you're oxygen.
I'm a bit out of breath.
Do you want to lie down a little bit?
No.
You sure?
I like to live on the edge.
Okay, well, you are living on the edge at the moment. If your oxygen goes below 90, we're putting oxygen
like my grandfather.
Do you have any,
he had a heart condition.
Do you have any chest pain?
Stop watching the news, Pa.
Sweetie, do you have any chest pain?
I want world peace.
I've got to repeat again.
So do I.
Do you have any chest pain at the moment?
No.
Okay. While we're talking, we're going to take some blood pressure. So the thing that was actually occurring was I was watching the monitors. I got my camera out and video recorded it. And the nurse, I asked the nurse,
we had a good nurse.
Could you just have a look at this?
Experience.
This is what's happening on the monitor. And she's getting pain. She takes one look. She goes, I'll just be back 2 seconds.
No, she slammed the button behind me.
What's that button do? And then suddenly all the white coats came. So that's when they did say, look, sit still, be quiet, relax, stay calm.
And I was like, what? I just wanted to go home. I was like, I want to go home. I'm young. I was thinking, I've got Pa's thing, don't I? That's what I was thinking. Because my Pa had a triple heart bypass in early 50s. Okay?
What does your dad also have?
He had a heart attack at about 36.
So you got family history of heart attack at 36,
yes.
Triple heart bypass before age 50.
Yes.
Family history is really important.
Yes.
You have got chest pain, and what we discovered was tachycardia, arrhythmia. Okay.
Well, she diagnosed me with a arrhythmia. She diagnosed me with POTS.
Postural orthostatic tachycardia syndrome, which is obviously exemplifying what we're having happen here at the moment, because now suddenly your heart rate's gone from 126 and just dropped down to 85 right in a split second. Orthostatic intolerance, one of the other challenges. But and we're going to talk more about this because you don't have just one thing. I know you don't like the century. I'm sorry, it's 104/63 is the blood pressure. 86 is the heart rate for that particular take at that point in time.
Okay, so
I want to talk more about this because you've got more than just one thing. You have irregular electrical patterns.
And with the heart bug, we found AFibs.
Oh, there's many AFibs that occur. So atrial fibrillation is what something Dyan has also got. But you also have arthroscopy of one of the main veins, which is a little bit getting clogged up.
It's regurgitating.
And you have the mitral valve and the other valve in your heart regurgitating, not pumping through. So what's your key symptom?
And my oxygen drops.
So you have irregular oxygen drops.
Every day into the 80s.
How much fluid do you have as well?
My heart rate during the night drops into the 30s.
Right. So fluid.
And regularly, for hours at a time, sometimes my heart rate is under 50.
So we're going to talk about a few things. Fluid is a
BP.
sign of heart failure. The edema, the full body edema.
Now. Since the first heart event, I had edema. Second heart event.
Has it gone away?
More edema.
It just keeps increasing.
So, and more symptoms. So since the second heart event, I am, guys, I know that a lot of you have chronic fatigue, and I don't say this to diminish that.
Sure, but fatigue
It's another level.
Yeah, so there's fatigue that comes part of this, and you've as well experienced fatigue.
Yesterday, washing my hair in the shower, I was crying.
Yeah, it was
my
the exertion,
body,
right?
I could not get my body to function.
So Dyan knows the difference of normal
function.
POTS symptoms. She's dealt with that for 30 plus years,
like
having MECUS, myalgic encephalomyelitis, chronic fatigue syndrome. But you're right. You also have this huge amount of edema that you're trying to deal with, and you're on furosemide.
I'm swimming in it. Like guys, I've put on a massive weight gain for no reason.
And that's
diet
also
change.
A point to look out for as a symptom. If you suddenly gain a lot of weight without recourse, are you eating differently?
It depends on other health things, but it could be fluid, ladies.
Is there medications that cause it? No, we've eliminated these things. Correct. So you respond to the loop diuretic furosemide. You're now on a very, very high dosage of that, by the way.
And I'm still struggling because there's still fluid on my lung.
Now, there is a thing between what they call dry weight and wet weight. What that means is with the fluid, the wet component, you would be around about 3 kilograms probably in difference.
Yes, probably.
From having full body edema, and that's also has this impact on the body and the system. You also have what we call, and we've had several medical specialists over the last year pointing this out when they've listened with a stethoscope, that you've got Krebs. Or it's a crackling. It's a crackling, which is a pulmonary edema.
And then my latest CT, you can see like fluid markings on my lungs, which, you know, can be mistaken for bronchitis, by the way. So be very cautious.
Do you have the symptoms of bronchitis?
Do not have the symptoms of bronchitis.
But you've got crackles, you've got fluid from an edema, and you have heart irregular.
Since the first heart event, so I've had a registered nurse pick it up.
Yeah.
I've had a ED doctor pick it up.
Absolutely.
You've picked it up.
Yeah, absolutely.
And
I know my way around the stethoscope.
The scan has picked it up.
So there's a lot of factors that come together. But this is part of the picture that we want to explain is, now normally you say, surely you just go to hospital and get these things checked out. Well, you know what? That's part of Dyan's battle with having a rare heart failure.
Heart failure, guys.
And it's a progression.
I am in heart failure.
Yep.
And the most expensive care for a hospital to give is heart. Yeah. Okay? They won't give it to me.
Seriously. And
they discriminate.
This is
based on
interesting
money.
Because Dyan actually went to several heart clinics, and each heart clinic that she was sent to, so she doesn't have a choice where she goes. She's sent based on the referral system through the central referral system, right? So you were sent to these, and when you got to the first clinic, what did they say? Wrong clinic. And then the second clinic, this is not the right clinic either.
And then they gave me an intern on the third visit, and she didn't even know what to say.
I know, right?
And I'm like, my geneticist wanted me fully checked, guys.
Actually, a few people wanted you fully checked. Your geneticist wanted you checked. Your rheumatologist, your sleep specialist, even your neurologist, and then your GP.
Neurophysiologist.
Oh, yeah, that's right. So you've got multiple different specialists in their fields, all wanting cardiovascular.
And they all said they were.
To have a look at.
And they were doing it, but then for some reason it's went.
It just disappeared into the ether, literally. Are you under a cardiologist at the moment actively? No.
Put me out to pasture.
That was the conversation he said.
Wasn't it? Put me out to pasture.
He also said.
Cow?
He also said, don't do any exercise. You're not allowed to do any hydrotherapy because it's too risky for your heart. Okay, so you're gonna do something about that? No, seriously. If you say in one breath, it's too risky for her heart, in the other breath, are you going to say, this is what we're going to do to help manage it? Do we get that? No. Would you like to do a stress test so that you can monitor clinically what the impact is? No, that's too risky. So what? It's too risky to do a stress test. Well, she's living her life. Having to go to the toilet is stressful. Having all these different symptoms and conditions part of 22q.
Trying to go back and forth to the toilet.
Just sitting up and doing this vlog, you've just seen her heart rate. Oh, sorry, your oxygen's now at 90% saturation. I'm going to show you because I don't make this shit up. This is fully validated. So she's just come up from 90 to 91% saturation.
Really?
Heart rate is 80. Because you're sitting up, is going to be increased from your normal baseline. But you see the huge spike that just went up.
All day.
This is what happens all day.
If I have a shower, it just goes above 160 and above.
Yep.
It just goes nuts.
Up to
I have a shower chair.
210, just having a shower.
I have a bath, I get similar effects.
But then you've also got other symptoms.
Hot water affects blood pressure too.
So let's have a look, talk about this.
Even.
You've had a couple of cardiac events, heart attacks, where you've been ambulance, 000, into hospital.
Do not pass go. Do not collect $200.
No, not much fun, is it?
Straight to the hell.
Now, in one hand, this is also a funny thing about the ambulance system. You've got a female ambulance officer who's showing genuine concern and listening to your condition and your symptoms.
My history, my epidemiology.
You've got the male ambulance, officer.
He says I'm young. I'm a spring chicken.
You're a spring chicken.
I said not with 20Q. With 20Q, I'm actually 81.
He's too busy socialising, but he's really just the driver anyway, so...
Oh, yeah, when we got there, even though with 3 nitrolingual sprays,
G10
an
spray 3
aspirin,
times. Yep.
my heart was still 90s, 100, and he's like, he's keeping an eye on it, but he's like, how's your holiday packing going, mate? to his other ambulance friend and ignored me.
Well, would you say that shows a difference in disparity between misogyny?
Oh, if I was a dude...
Just focus on this.
Exactly, if I was a dude...
So there's a misogyny in the system, even at the level of ambulance or nursing or medical staff, that comes across. Just like that first doctor you were telling us, where you're sitting in an ED bay going, are you a little bit anxious, sweetie? You know, these are the sort of comments that females actually get.
What it turned into, but what if it didn't turn into that?
100%.
What if I went home and guess what? Can I just talk about the check-in before I got to the doctors?
Yeah, sure, please do, because it's very relevant to a conversation.
In Australia, you go to ED, you wait 6 to 7, 8 hours. In ED, in a shitty chair. This is what you pay extra tax for.
Yeah.
And in Australia, you were paying most of your wage, 50% of your wage in tax. Just saying, for 25 plus years, just saying. And then, after waiting there, you go through and a nurse does like a blood pressure, temperature, little basics, right? Ask what's going on while you're there. Fair enough. And she literally did the blood pressure so tight to be a bitch.
Okay.
To be a bitch. Because obviously she didn't believe that I was there necessarily. Because I'm so young. So here I am, 32 with heart symptoms. And look what happened. There was a heart problem.
Yep.
Yet I am being made fun of before even being medically evaluated.
All clear.
She's made a judgment, probably an enrolled nurse. Sorry, enrolled nurses. I don't mean to be. But
there's a bias.
Good nurses, bad nurses, right, with RNs and enrolled.
Yep.
Both of them are beautiful majority
Many
of
the time, but sometimes they can't.
Nurse was so nasty that she overinflated the cuff to be a
So they can be rude, they can be a bit more aggressive.
That's physical assault.
Yeah.
That's physical assault. Let's just break it down. How I felt violated.
Sure, so you felt violated.
It felt
that's
like
not a positive
physical
experience.
assault. I'm sorry, but that was covert physical assault by
but
a
during
medical
this,
practitioner.
You're also being dismissed for the symptoms. You're being basically saying, oh, it's calm, just go home.
Correct.
And that's funny because even the ambulance officer, look, there's nothing wrong with you. You know, this is unnecessary.
But you know what else happened?
But hold on, let me just talk to her for the moment.
There's a second part to that. My results.
Yeah, I'm going to talk about that. So, first of all, with that ambulance officer saying, hey, there's no stress here, nothing going on, dude, we've just treated you in a home environment. We've given GTN spray. We've given... Oh, don't talk about this, sweetie. We've given you a aspirin already. We've calmed things down. It's taken you long enough to get here.
8 hours later.
So, the reality is, though, the ED doctor actually prescribed you and looked at your results that have actually been presented multiple times to the hospital to say, look, I think there's an issue with hyperkalemia, and in a difference of potassium. The potassium levels are too low. Why is that? You literally were. You were. She's not singing. She was literally seeing.
I was asking him,
visually
isn't this
green.
Blanket white? Why is it green just in this one patch? Is there a green patch?
Which is the side effect of the potassium.
I said, am I hallucinating?
No, you're
not.
not.
Have I got the schizophrenia?
No, you don't have the schizophrenia. So,
sometimes I wish I did.
I wish you did.
I wish I wasn't even here.
And that's a side effect that can actually occur with 22 patients. Dyan doesn't have that, but that's a separate side.
I went the autistic way.
Now, interestingly, the consultant in ED immediately goes, well, hold on, you're seeing green. The blood tests show very low potassium. How long have you had this? And then he goes back and goes, why wasn't this picked up? Why? When did you start?
I was here a year ago.
Well, have you not been on potassium tablets?
No.
What do you mean? You should have been on supplementary potassium. It's like, no.
I get my full blood
This has been missed. It hasn't been done in the various heart clinics along the way. Yes. Now, when you go on the potassium, what difference has it made to your life in regards to the use of the GTN?
Massive changes to needing the GTN. The GTN was multiple times a day to...
Once a week, maybe?
Maybe.
So if you go from sometimes 4 times a day to once a week, that's a big change. And do you get the same arrhythmia patterns or things like that?
Well,
the chest pain as much?
Well, I get different symptoms now, so it's hard to tell because, yes, I think I've corrected a little bit of something, but I've got things increasing for other reasons.
Great, answer that.
But I want to go back a bit before this bit.
Sure, but I just want to point out before you do, there's 2 things that you now on potassium to deal with arrhythmia, and you're also on fluid tablets.
Another mistake made in my 30s was I go to my doctor where they send an outpatient report to your GP centre. I always went to the same centre for fucking years.
Consistency is important, right?
Same records, doesn't matter which doctor you see. And I even tried to see the same doctor.
Very clever. That's sensible for consistency. Building up a rapport, history.
I did all the right things.
Tick. Okay.
Anyway, this was a new doctor, and I was like, I'll just take that appointment because all of them were busy. Okay, for days. And I was like, no, I need to get in there and see this person. I had an infection. The sooner I get on the antibiotics, the sooner I get better, right? So anyway, I'm like, okay, I'll see him.
Okay.
As I saw him, and he goes, obviously being a new doctor, he just goes through my whole records, and he's like, there's a report from the cardiologist here. I said,
sorry, what? What report?
That was a long time ago.
That was over a year ago.
I said, about?
Yeah, about.
And he said,
what was it about?
Oh, you're meant to be on a beta blocker. I said, huh? What?
Okay.
And I said, when was this done? He said, it's been a year. Surely this has been read to you. I said, no, it has not.
Okay, so another thing missed,
So for a year, I'd been to that doctor's surgery for other things in that year. Trust me, I'm 22Q. I'm always at the doctor, okay? Okay?
And this is after the cardiologist has said that you're probably going to need to be on a pacemaker, but you need to try medications first.
He said to me, if this beta blocker doesn't work, then we're going to have to do another ECG because you're probably going to have a pacemaker.
Okay.
So it was already in the report. But he gave me the report a year later.
When you went on beta blockers, how did it go for you?
Well, I was volunteering at the time and I felt a little bit, this isn't good. So I thought, I'll just pop into the doctors and just walk in and say, it's because he said to me, if you have a reaction to it, just feel free to pop in and get checked because they had a nursing station kind of. It was a well decked out
clinic.
Clinic.
Sounds good.
So I walk in and I'm like, even if I have to just make an appointment, that's fine. I'll make an appointment to discuss this uncomfortable feeling.
Right.
So I said, I don't know if I need an appointment or whether there's an appointment available because in those days you sometimes could get a walk-in if it was quiet, and it was quiet. And I said, I've been put on a new medication and my heart's just going and I don't feel right. I feel, and she could see I was shaking.
Okay.
And she's like, okay, I'll take you through to the nurses and we'll do an ECG. Is it ECG?
It's ECG, electrocardiograph.
And then I'll try and get one of the doctors to see you. And she asked me which doctor I'd seen before who put me on the medicine. And he was there.
Lucky he was there.
Dan.
Yeah.
Because I didn't like him.
Oh, okay.
We had a bit of an incident in there.
Okay, keep going. Refocus.
He called me anxious because I asked about why I was sick in general because I don't like quitting my job. And he was like, you just have to accept it. You know,
you have to accept being sick.
And I looked at him, I'm like, you're not much younger than me. Shut the fuck up. I'm not even beginning.
Yeah, would you like to help me actually be able to have a job?
Yes.
Yeah, okay. So what happened after you come in
there and they read it and he goes, oh, you need to go off the tablets immediately. No more.
Right, okay.
And I'm going to keep you here for, I don't know how long I had to stay there.
Right.
I had to stay there for a little while. And anyway, it's like, he's like, don't take it. Don't take that anymore.
Yeah. Did you pass out anything? Faint?
I felt like it,
okay,
but I didn't. And basically, when I felt okay to leave, I did. And I wasn't far from the surgery. But anyway, I went home. But basically, he's like, go off the medication and now you're going to have to do another heart monitor thing and then go back and maybe look at pacemakers. But of course, pacemakers are for only private patients.
Yeah, or if you meet certain criteria, if you're a male or you're a certain age. Okay, so I want you to have a rest for a moment.
I'm just going to read a few things. In the public system, like you're pretty much almost dead, and then we'll go.
Yeah, sometimes I do leave it a little bit too late. So let me read a few of these things while you're catching your breath because I'm still monitoring the heart and oxygen over here, by the way. Now, symptom and presentation differences. Before I get into this, one of the things I pointed out was that Dyan's autistic. So with interoception, there's a difficulty in knowing your own internal states and also how to communicate, how to relay that. How do you explain that this feels funny? What is it that feels funny? So that's a difficulty. A lot of autistics don't go towards healthcare, by the way. They don't even know how to use a pain scale and interpret, let alone even the faces with alexithymia. How do you understand the feelings when someone shows you?
All the happy ones look the same and all the sad ones look the same.
These are some of the differences.
There's happy, there's sad. Where's the others?
Now,
I don't see it.
Here's some of the things also to do with the general population, not just those with, very much genetic conditions that relate to it, but general population and females should also be aware. Now, there's different symptoms. Women do often present with less specific symptoms like shortness of breath, fatigue, nausea, pain in the jaw, back, arms, rather than the classic crushing chest pain often associated with heart attacks. Well, funny enough, even when you had fatigue, intense nausea, hyperventilation, pain in your jaw, pain radiating around to the back.
I had the pain was in my heart. I know where my heart is, and it went to my shoulder blade.
Yep. So
each time I had this.
They can be ignored. Misdiagnosis.
Because it's women's symptoms, you see?
Now, these less specific symptoms are sometimes mistaken for other conditions, such as anxiety or gastrointestinal issues, leading to a delayed diagnosis. Isn't it funny? Because I do
get anxious, but I know when I am, and I would say when I am.
And isn't it important?
Asshole.
But that's the important part, is for the doctor to ask you, are you anxious, darling?
And if I say no, I mean it. But guess what? If I was anxious, I'd be happy to admit it. I'm not ashamed. I'm autistic. I have 22q that has anxiety in it.
Now, you've also got gastrointestinal because you've got gastroparesis, which also includes GERD and reflux and things.
That's great.
But you can differentiate between what is a reflux
and what is gastroparesis.
And what is a chest pain coming with angina or heart.
To what is a panic attack. Which I don't actually have panic attack, guys.
You've never had panic attacks.
I just have anxiety, yes, but I don't have panic attacks.
No. Now, vague symptoms, women often experience milder or more ambiguous symptoms than men, leading both the patient and the healthcare provider to downplay the severity of the issue.
Yes.
But what happens if you keep presenting? Doesn't it accumulatively get to a point where maybe after the first few times or the first year or multiple years, doesn't it start...
epidemiology for me? What's my risk of dying right now of my 22q?
Well, you're past that expiry date.
What's my risk factors? What should they be looking at? What part of the body?
Well, the heart predominantly, obviously, vascular system,
so
absolutely.
So if they wanted to save my life, guys, so if you don't believe in eugenics, they don't want to save my heart because I have 22q. But if I had, this is the same as the oxygen. If I was a smoker, if I worked on the mines, I'd have my oxygen right here from the WA Health Department, right?
Mm-hmm.
So that's the same thing with this. If I was a working man or a working woman, they would probably give me treatment.
Now, on that note, I've obviously had heart-related issues. In fact, I've even had a stint in my heart. If I present to hospital with the exact same presentations of what Dyan does, and I've compared, I get treated incredibly differently compared to what Dyan does firsthand, because I've been there for both cases, obviously. So I do understand that. And I've got an understanding of the different test protocols that are used because I've had to experience them myself. I also understand that when I've talked to cardiologists going, but why don't you do the same test that you've done on me, which is relevant to Dyan? And they go, yeah, we could. And look, it probably would show what we're looking for, such as an SVT, a hole in the heart. Okay, but then why don't you? It comes down to this dollar sign thing.
What's an SVT?
Let's talk about holes in the hearts. So let's talk about some of the other things. Accurate testing. Less accurate tests. So some diagnostic tests may be less accurate in women. Now, you've seen that before with things like the Epstein-Barr. If you don't, for example, get the blood test at the exact time when you're running a fever and violently sick, that test won't show up accurately, right?
At the time of getting your blood taken, actually taken, then you will not get glandular fever show up.
Are you smaller in size than most males? Would you consider that?
Yeah, I'm smaller than most females.
Right, because your condition
when I go to a gynecologist,
they
go, say there's a table of speculums. I know this is gross.
Well, there are different sizes of speculums.
So there's speculums, right? And that's the norm.
Yep.
They go, oh, yeah, we need this one.
Yeah, juvenile.
At the other end.
Correct.
Okay.
Same thing for your blood calf. It has to be a small size.
They go to the children's part of the hospital. They get a child's cuff.
Same thing with the catheter.
They wrap it around my bed.
They have to go to the children's hospital to get the child-sized catheter for you.
Correct. When they tubed me 5 times brutally, it's because they didn't have the right size.
They didn't know the right size. Do you also have a smaller head size than the standard population?
Microcephaly.
Okay, and you have a failure to thrive.
You just need to measure your head.
You're almost dwarf in size based on the measurements.
By inches, I'm off of that.
Just off. So this is small size.
I'm just off.
Take all those points and notice when I'm talking about the less accuracy in diagnostics. For example, some tests may not be as sensitive in women to the smaller artery blockages that are more common.
Interesting.
Okay. The bias come in. Now, there's a biased diagnostic criteria. So, for example, diagnostic criteria is developed based on the male physiology instead of females that can lead to an undiagnosis in women. For example, we can take a disproportionately larger increase in heart size for women to meet the same risk criteria as men.
Science ain't sciencing. You need to redo the Science on Women. Fact. Heart Foundation of Australia, you need to get onto that. You need a campaign. I'm sorry.
No, absolutely.
This is unacceptable. And in your own country, you need to do the same thing. Heart care for women needs to be trendy. Stop talking about just the boobs. And by the way, government, where's my free mammogram? I'm 50.
Yeah.
I'm about to turn 52 in half a year. So basically...
these things need to be done regularly.
I need... What was I asking for?
A mammogram, sweetie.
No.
Testing?
What was I recommending?
I have no idea. Keep recommending. Let me keep talking. Lower referral rates.
No. What were we just talking about? Because there was the point.
Okay, what was your point? I don't know your point.
There was a point.
Okay, we were talking about mammograms before about biased testing criteria.
Yeah, so forget about just testing for us women, our boobies.
Right.
I know you might like them.
Okay.
Most of them are men, okay? Probably even in the research department, let's be honest. I'm sure it's boobs all over the wall.
Okay. But we need to focus on the heart. Focus on the heart, not the boobs. Okay, that's an important message for today.
Focus on the heart, man. Let's do some heart research.
Sounds good.
Women. Women.
All right. Now, there's actually lower referral rates from the GPs into cardiology. Women are less likely than men to be referred to or receive certain diagnostic procedures such as cardiac catheterization. I actually asked for a cardiac catheterization to actually look at the internal blood pressure because of your type of condition. It's one of the things that come under this condition of 22q. It should actually be looked at as part of the differential testing just as much as a cardiac contrast MRI, which is actually diagnostically shown in the cardiovascular journals, peer-reviewed, as necessary, but it was refused, okay, even though her GP has actually specifically said she actually needs this done. The research for 22q actually specifies that this test is actually necessary. What are you doing? Did you know that her GP wrote a very scathing letter to the cardiologist and going, what are you doing, dude?
What?
This patient has got 22q. There's international clinical guidelines. You're meant to be actually doing all of these tests. Even do a stress test, do a cardiac MRI, actually do a longitudinal Holter test, actually monitor every year, actually put her into hospital when you do some medication changes.
Well, the nurses were worried.
He actually asked that 5 times.
They kept coming in and waking me up early hours of the morning and saying, your heart rate's in the 30s, I have to take your blood pressure.
Yep.
So, yeah, we can kind of subpoena them, you know.
Oh, yeah, we got data. Now,
but,
you know,
I'm in heart failure.
You're in research around the world with your DNA for things like FARS and seizures and 22q and MECFS. So your body, her genes travel around the world more than she does, but she's in part of genetic research.
Yes.
But here's the interesting part. There's an underrepresentation in clinical trials. Historically, women are underrepresented in these clinical trials, meaning that there's less research data on specific cardiovascular disease presentations and how to best manage them.
Are we still ignoring the women?
Male misogyny in the healthcare system?
Are we still ignoring the women? Are we, do you know what we do? Do you know what we do? We cook the humans. Do you know what it's like to birth it? You have no, when you think of pain, men, you don't know pain. Childbirth, you don't know pain. Okay? No. Please research. Once again, if you are a young medical nurse, doctor, please encourage heart care to women. We know about the man. They're good. Let's research the woman.
Did you also know there's this
woman?
There's this protein that is actually initiated in having a heart attack called troponin. And the levels are different between males and females, very specifically. It's a simple test that's done in an ED environment to see if you've actually had a heart event, a cardiac event. But if you don't also know your baselines and understanding that it is a different result, your lower levels may present as looking as being okay, whereas if it was shown in a male, it'd be presented difficult because, again, all the anatomical size and the heart size and everything else. So it actually creates a bit of a false positive in a sense. So it is another known issue. Now, there is a provider bias that actually occurs. There's an unconscious bias among healthcare professionals who may be less likely to consider or adequately investigate heart disease in women, because that's how they're trained. That's how they go along. They go.
22qers, for example, if they didn't say, they do know I have 22q, but they are denying it for... Now, let me just explain it. It's so fucked up in Australia.
Please.
They're denying it due to legal reasons. If they admit it, they're admitting that they failed to pick it up. Because King Edward Memorial Hospital picked it up. Okay? So the other hospital goes, oh, shit. So they're panicking. And so instead of giving me quality healthcare, they're like, don't touch her. Just don't do anything.
Yeah, so this is one of the issues that we are dealing with.
And doing nothing does harm, right? So
right.
at the end of the day, it's when you've got 22q and say I didn't know I had it, and yet I'm having these symptoms need to be investigated, right? And if they're investigated, then like with my tests, we keep seeing things because there's something there. But the only reason why I think I'm getting somewhere with getting those tests is 22q, but you shouldn't need that because women without 22q, you guys who are women out there can get a heart condition at any point. You don't know. Yeah. You're just as susceptible as a man.
Well, look, you're very more susceptible because
I am 22q,
let me talk for a moment. Because you've got a fatigue condition, particularly the MECFS, myalgic encephalomyelitis chronic fatigue, you have spent years, decades
multiple
in
fatiguing
bed.
conditions.
Now, because you're in bed so much, you are not upright. You're not walking around. You're not exercising, so you're not getting the normal circulation that's going on. You tried to exercise and your heart was off the charts and oxygen levels were going, we need to get you to ED.
Hits my butt.
But that's part of the problem, not being supervised. Okay. Now, there is also cultural perceptions that heart disease is a male illness only. You've also been affected by other aspects, such as the beauty effect. Just because you're a female, because you might brush your hair or dress well.
But EDS, guys, even being 51, they think, oh, you're so young, you'll be fine. And then until they see my history, this is before they know my medical history. Like, I've got 22q and heart symptoms and heart diagnoses. Like, but I also look 20 years younger because of EDS. I have the velvet skin. I don't have the wrinkles that my peers do. I don't have a lot of, like, I failed to thrive. I have a young looking face because I didn't grow. And guys, it's not actually a cool thing. This is what frustrates me. Yeah. When people used to say to me, when I used to be socializing a lot more, you know, you're so lucky, you look so much younger than what you are. I used to want to go out of the room to cry because I looked the same as high school. And you know what? I wanted to grow up. I wanted to. I guess for me as a woman, I felt like I don't have the woman face. I didn't feel like I got that blessing of growing up.
But that has ramifications, and visually,
and it goes against
a doctor who sees you and goes, well, you look young. Just like that ambulance driver, the male one, goes, well, you're young. Well, Dyan's genetic condition, chronologically she's 51, mentally she's under 20, but physically she presents 3 decades older, so equivalent. Her health conditions, the symptoms are presenting as if she's an 80-year-old. This is what's in the clinical guidelines for that condition. But the beauty effect actually distracts medical professionals.
I like that they said in the letter, we do everything to follow the guidelines. See you in court, bitches.
Okay, so there are guidelines that actually very specifically pertain to this condition. And that's lucky because that actually does actually help Dyan to try and navigate through and actually get it. But there's a lot of females who can present, unfortunately, with many of the symptoms and just be brushed off, swept away, ignored. Sometimes until it's too late.
Don't find.
So and you do have to persist.
Sometimes you have to persist to get the results. Like, we've got the results from different things because we've persisted. If we didn't persist, we wouldn't have got certain, even just basic things like a lung x-ray or a lung scan to see if what's in the lungs, right? You have to push to get, you know, adequate care.
But should you?
So
should you have to push is the question. Yeah.
Never gaslight yourself, women, because we all do it.
Yeah, and the system does it. The system is very misogynistic in Australia.
The system has designed it to be that way since we were children, is to look at authority and go, bow down. But you know what? My Uncle Ray from as young as I was able to understand. I don't know how long he was telling me. He said, do not listen to authority. You make sure that you treat them the same as anybody else and suss them out the same as anybody else. Judge. Judge.
We'll get the facts.
Are
Ask
they
questions.
knowledgeable? Are they ethical? Are they doing the right thing?
Absolutely. Or what's influencing?
Just because they're a doctor, guys, doesn't make them a good
No.
person, doesn't make them someone who wants to save lives. There's many doctors that kill.
Now, unfortunately,
we see it all the
the
time.
Australian health system is under pressure financially, just as much as the disability system, as we've seen, and that actually informs decisions of pathways. It might mean that you're going to be less likely to get tests. Your GP, for example, can only do tests up to a certain level, your primary care physician. Specialists need to do the other tests, otherwise it costs out of hand. You don't have private health cover because you're a person with disability. You're on the disability support pension.
Well, the
you
private
can't
health
afford to do it
cover
privately.
has changed as well. So if it was the old way, which we had private cover when you were working, if it was the old way,
Yeah.
I could afford it.
Correct.
But they've made it stupid.
Yeah. Now, here's one of the other
My job.
anomalies, and I know,
But apparently,
I'm going to take that microphone
in
away.
Perth,
Yeah.
private's not doing too good.
Yeah. Oh, I think across Australia there's
Apparently,
a
it's
lot
not
of
doing
issues.
too good.
Now, the other key fact I do want to point out, if you're a patient who's sitting quietly, nice and relaxed, in a nice air-conditioned environment,
Making jokes.
sipping fluid in an ED,
Being stupid.
that's not the same as a real-world stress situation. Running around with kids who are not cleaning their room, having to do the shopping, physically up and down climbing
Showering,
stairs,
washing my hair.
showering, whatever it might be,
No.
physical activities that create exertion.
Playing with the
And that's
cats.
why even Dyan's primary care
That's
physician has said,
exhausting.
look, you need to have a stress test, because when you do a stress test, it shows your heart in a real world scenario so that they can clinically actually get data to say,
Correct.
how do you react? Because you're not going to just lie in bed like this and not move for the rest of your life so that your heart doesn't...
I'm on life support.
It feels a bit like
I
that.
am. But
Now,
I am. Like,
I know
the
you
way
are.
I'm living, the way... Indigestion.
Indigestion?
The way I'm staying alive, guys, is by resting.
Massive accommodations and
because
adjustments.
this is another fact that I want to give you, and don't let this be an excuse to not exercise. You must exercise.
Well, you can.
Don't
safely.
over-exercise like I used to do, but I had ADHD. I'd go to the gym on a Saturday and I'm like, shit, he's going to find me, isn't he? And this PT would come up and go, you here again? 6 days. And I'm like,
She's a little bit
I used to
overkeen.
overtrain. I'm
You did.
like, I'm an ex-dancer. Okay, this is nothing, dude. If you think this is hard, you don't know. You don't know what dancing was like, okay? Because in dancing, you got to act like you're not exhausted in the face.
Just 2 moments. Just while I'm
What?
talking, I just want to
What?
point out what we're dealing with. Oxygen stats is still at
They're fine.
92%. It's
Brilliant.
actually
68.
gone down to 91%. Heart rate's 68.
Oh,
so again,
big.
and now it's
Oh,
jumping up
sorry.
again. So you can see this is why we
Yeah, I
monitor
lost my
regularly.
position
Even
where
at
I was in my
night time.
conversation.
Well, at night time we
Yes.
actually have the seizure monitor, which is called the night watch. It's a device that actually
Measures my
monitors her
heart.
heart rate. So in case, if and when she
Bit
stops
of both
breathing,
then, isn't it?
there's an alarm that
Scrape
comes
the
on
heart.
so that we know what to do. I've resuscitated you. I've done CPR
It
on
woke
you
us
before.
up one night,
so
not
I've had to
long
actually
ago.
do CPR and done several times before.
And I
know
remember
what it's
waking
like.
up to the alarm. I'm going, shut up, shut up. And he's getting up. He's like, sweetie, it's saving your life. I'm like, shut up. What is that stupid thing?
Okay.
I'm trying to sleep.
There's a bit of sensory over. Just as much as she hates blood pressure cuffs and she has a love-hate
My
relationship
heart
with
rate
her
went
Google.
to 32 or something, didn't it?
Yeah, 32. That's okay.
And
It's there
actually,
still.
there was even maybe a millisecond or a second of nothing.
Yeah.
Actually.
Yeah.
Yes.
Now, because of the primary risks of what's going on, one of the things that we've been looking at trying to get hold of is a defibrillator. In the last 000 emergency event, where the ambulance took 15 and a half minutes to get here, the very first thing that the 000 operator said, go and get your defibrillator. You're going to need it.
NTIS, you've got to add it to the list. This is why we didn't get it, isn't it? They don't actually
Well,
have it on their list.
It's a
They
thing
don't have
between NDS responsibility for disability
Or health
and
department.
healthcare. And rightfully so. I actually agree with them.
Yeah, it's the health
It's
department.
actually
I
the
do agree.
responsibility 100% for
However-
the Health Department of Western Australia to
However.
actually support, monitor, test, and medicate and provide appropriate support.
Agree. However,
Yeah.
both departments
That's
work
tough.
for the government and the federal, you bloody idiots. Okay,
the
and
bad
state.
stuff.
So what the hell, man? You're going to pay anyway.
So what they do is this. he shared seizure. It's your responsibility. No, it's your fault. No, you need to do it. No, you need to do it. I've been doing this for 3 years. That's all they keep doing. And it's like, for God's sake, please. Anyway.
What was I saying?
I don't know. It's something very useful, my dear.
It was.
It is always very useful. It's very important information. Sorry, Dyan has difficulties with ADHD. And obviously because of the lack of good blood flow, circulation, and lack of oxygen to the brain. This is why she gets so much confusion. This is why she is fainting and passing out. So syncope and pre-syncope.
Where I'm at in a conversation.
A lot of the time in the seizures, when we're getting massive heart rate drops from tachycardia all the way down to bradycardia, she is passing out a lot more. We're not getting enough oxygen flow to vital organs. And that's indicative why she's also having aphasia, difficulties with word finding, stuttering and slurring,
so
cognitively
tired,
exhausted.
I feel like I'm
confused. It's not helping.
Guys, the tiredness, and that's why I'm saying please don't be offended if you do have ME/CFS, but it's worse than that. It's a tiredness that I feel like, most nights when I have my bad days and I go to bed, I'm scared to go to sleep.
Yeah,
I'm literally scared to go to sleep because I know my heart rate will slow down. And see, that's fine for everybody else, but not for someone like me.
No.
So when I close my eyes and I know that I'm not having a good day, and it's funny because that's always the time when you'll say to me with these devices, you don't want to know your results. It's like, I can't know. I know, right?
In between that as well, got to understand that Dyan's got a multitude of things going on. Dystonia, which is irregular muscle contractions, can affect obviously the heart. She's going to be having seizures in the middle of the night. The primary time between 10 p.m. and 4 a.m. in the morning is the worst period of time for nocturnal seizures, where they can cause her to roll over, stop breathing, her heart to do irregular things, under stress of tachycardia. These are high risk. So we are dealing with a lot of high risk, which is why it leads to a high incidence, high risk of having a cardiovascular event for patients with 22q, unfortunately.
Absolutely.
I really appreciate you sharing a lot of these anecdotes of your experience.
I just want to share, if anyone else out there knows this, particularly, I feel like this is kind of a selfish thing to ask for, but if anyone else is going through heart failure, I would love any advice, any journey stories, because it's A, scary, B, the lifestyle's brutal.
Yeah.
I can't function anymore. My last shower, I just cried and cried because my body feels dead. It feels dead, but my spirit is so alive.
Yeah, you've got the energy, the enthusiasm, the ADHD.
I know a lot about, and I'm not saying, we're all dying, as in because as each day goes by, we're all dying. So let's think of it that way. Sure. Let's not get like, but when someone's body is winding down, there is a lot of things you go through psychologically, emotionally, and physically that change, right?
Absolutely.
And you're very alone with that, unfortunately, because everyone else around you is so alive physically.
Or that expectation that you look younger, they still treat you as younger.
I'm mentally alive. Yeah. I'm spiritually alive.
Are they treating you like an 80-year-old? Do they see that perspective of your risk? And that's what you're really trying to get across is Dyan is really in this. She is dealing with this
any day.
I say this openly and honestly. Her GP says the same thing to me and to her. Look, the risk is there. You could die any day. We're consciously aware of it. We know that Matt's resuscitated you multiple times. We know that you have made so many accommodations. You've got alert systems. You've got a SAMI3 camera watching you. You've got a pulse oximeter with alarms. You've got a seizure night watch devices with alarms. We're monitoring her.
But my fear
all the time.
I don't trust the system.
I'm not surprised because of the experience as a female.
I don't trust that they want to keep me alive if I get in their hands.
The average diagnosis time for rare genetic conditions is 8 to 10 years. Out of the 7,000 rare conditions and 250 new rare conditions are added each year, only 5% out of all the rare conditions have actually got treatment and management plans in place currently.
It's disgusting.
Ridiculous.
Unless you're rich, and I think that's
choice.
And the way I look at that, guys, because most of us aren't, is those people are going to lead the way for 22q.
Yeah.
Because those people, if they're getting access to some kind of care for a child or an adult, then that research, that knowledge from that doctor can go out to the ethos And hopefully someone else will pick it up.
But they can, and I've got to say, money does tell here. Money gives you access to testing that you can't afford.
Correct.
Money gives you access to medication that you can't afford. Money gives you access to specialists that you can't afford or have the skill sets in the public health system.
Is there a heart surgeon in Perth that we would trust?
Well, that other heart surgeon from over east had to be travelled across to do stuff. So I understand that.
When my geneticist diagnosed me, she specifically said you should be living in Melbourne or Queensland.
Now, I just want to talk about not just 22q. Dyan does have Ehlers-Danlos. We've mentioned that along the way. It is a connective tissue disorder, but it also means that organs can move around. The skin is fragile and can tear easily, and so can organs such as the heart, particularly the aorta. The valves can explode. Yeah. So if you have EDS, one of the 14 types of Ehlers-Danlos, be aware that that's the same. So that means hypermobility can also be vascular EDS.
You must get your heart checked.
You must get that. You could have multiple, 3, 4, 5, 6 different types of having the variations of EDS. If you've got a diagnosis of hypermobility, please get it checked out.
We don't get treated for EDS in the public system because they don't even know it exists.
No, as an example,
the geneticist does, but
you went to a radiologist to do, it was scans at the time, I think it was CT, and they were trying to find your organs in your abdomen, and your ovaries had actually...
She's like, what are your ovaries?
Had it been surgically removed?
I said, no.
No.
I said,
Things move around, flexible, it happens all the time.
I went to hospital once because I did a backflip and the pain made me pass out, remember?
Endometriosis.
Remember when I was passing out for, I think I was passing out for like an hour.
Yeah, exactly.
And it was intense pain, right?
Ehlers-Danlos causes a lot of pain.
And it was my tube and ovary just doing some flippy flips, right? But basically...
That's a technical term, flippy flips. Okay.
She was like, well, no, I got to find it. I'm like, okay.
Keep looking, honey. You'll find it.
Okay, you'll find it.
It's just, we're very reassuring to her.
Found it. It's around the back.
Excellent. She found it.
I said, that's great.
That's great.
Don't really care. Definitely not having any kids.
But you've got to understand that this is also why things like gastroparesis occurs, because of the flexibility, the hyperflexibility, the elasticity of the GI tract. This is why the compaction, the impaction actually occurs with those sort of conditions. And obviously vascular-wise, not just the vascular, but the heart itself can do things.
Do you know another problem with heart failure?
What's that?
Is the automatic nervous system doesn't function as well, including the GI tract, which includes the stomach and the bowel.
Yeah, I understand that. I do get that. I also wanted to tie in specifically for 22q patients, because there's a lot of people with 22q on our channel. Be mindful that the 3 nerves in the brain, the trigeminal nerve, the vagus nerve, and I never remember the name of the damn third one, but that vagus nerve is the longest nerve in the body. It's also known as the wandering nerve in Latin, but it actually wraps around the heart. It actually wraps around the GI tract. These are causations for having gastroparesis, but it also adds to irregular heart rhythms, which is known for patients with 22q. Understand the condition, do your exploration, look at the medical journals, bring the information together. You have to educate, and you have to advocate for patients, because they don't know, they don't understand.
With 22q, if you are not getting checked from head to toe by specialists annually, you are not receiving what's under the guidelines of 22q.
Yeah, correct.
If you have no symptoms, that is the protocol. If you have symptoms, then you should be going for those symptoms extra until that specialist goes, oh, okay, this is what's going on.
Correct.
But the other problem is, sadly in the UK and Australia, we know for sure that in the public system there is no specialist for adults.
No adult specialist in either of those countries.
Specialist. So this needs to change.
Correct.
This needs to change. Everyone deserves healthcare. We shouldn't discriminate based on the diagnosis, yet we are. And nobody knows about it. So if you can share anything on your social media, just to state that, you don't have to promote my channel or whatever.
Be nice if you do though. Please share our channel. It helps.
At least, I'd love you just to at least state, do you know that rare disease, rare syndrome patients in UK and Australia do not have a specialist? If you are public, for example, and possibly private, have to travel over. Some people with a lot of money have to travel over to other countries
and this is where
to get healthcare.
Medical vacations, travel, holidays
America
comes in because people are going overseas to access
if you've got good insurance.
What we can't get locally here in our country. But again, you've got to have money to do that. So there are barriers of accessibility. We don't choose to be impoverished below the poverty line.
It's the disability.
I would love to have my company and my career, which I worked hard for. I've had to actually stop working because
my fault.
The public health system wasn't actually keeping Dyan alive. So I had to make informed decisions to do so.
Because I've lost 25, 30 years of my life, and so this is my retirement.
So we're living our life every day.
On life support for me.
On life support. But we make the most of it.
We're working on it.
We are.
I'm always hopeful, and I always know that Jesus decides. Not you, doctors, by the way, just in case they're still spying. They're very worried I'm going to sue them, and I'm going to if I get the opportunity, because I'm right, and I have the receipts. So many receipts. It's just exciting, actually.
It's just negligence. It's
and if I'm dead, just go for it. Yeah. But basically, just look after yourself and know that you are worthy of healthcare, regardless of what anyone says. And
equally worthy.
Doctors are not
gods.
They're not that smart.
No.
And I'm not saying that because I'm obnoxious.
No, it's just a fair evaluation.
They're not that smart.
In all perspective, I've got to put this out, most medical professionals will not come across in their entire working career, let's say it's over 30 plus years, a patient of 22Q. That's just what the literature actually explains. Not every
neurologist is an epidemiologist.
It is under the rare guidelines in Australia, the national guidelines for rare disease, recommended and advised that primary care physicians and specialists actually reach out to centres of excellence to get information, to upskill, to learn about the condition. The problem is we don't actually have adult specialists for 22Q. We don't actually have a centre of excellence in Australia. They're working on that, but we don't have it yet. And that's what we need to keep putting our money and investing and put together. So the rare organisation is out there, and they've gone to federal parliament. They're working with the federal health minister.
Probably not getting anywhere. Because at the moment it's trendy in Australia to be greedy.
Yeah, it's all about dollars. And they don't have the money at the moment.
Let us all die.
So that's the process. Now remember, you don't have to be a person with some sort of rare genetic condition or ear loss, down loss. You can be a lay person. Females are more susceptible and are at risk 4 times more likely to be gaslit about heart conditions in the Australian public health system, unfortunately.
That's the most important thing.
Yeah, absolutely.
Right? If that doesn't, like, you can afford to have a misdiagnosis of, I mean, it was kind of annoying when I kicked my toe and it was broken and she said, you're fine. And no x-ray. 6 months later, I'm like, it's still sore, to another doctor. X-rayed. I had to have an operation to get dead bone out of my foot.
Because you kicked
Very
gaslit.
inconvenient because I was gaslit, right?
Yeah.
But with your heart, remember this. Okay, you can walk away from you choose your battles. I know what it's like to be working and raising children and dealing with dickhead doctors who say dickhead stuff, and you just go, I can't deal with you today. Bye. And then you move on and you put up with the pain. But when it's your heart, you cannot ignore it.
No.
Just please don't ignore it.
No, please.
Because I fell for the gaslighting too, many times over. And that's dangerous for my health. It would have been dangerous for my health.
Absolutely.
And I need to keep that in my mind now, because I gaslight myself now still. Oh, I'm getting this. Oh, it's chest pain.
I'm also going to put in...
But I won't take a spray because it's probably just indigestion.
Sorry for a moment, as we wrap up. From a lived experience as a male in the healthcare system, I just say that, look, males do get treated slightly different. There are still a lot of issues in the public health system. I, for example, have obviously got a rare blood disorder, lupus AC. It is another rare genetic condition I happen to have, which causes my blood to be very thin and doesn't clot correctly. And with that, I've actually found that I've got a hole in the heart. They took a lot of time, many years, to do the right test to
how many kidney infarctions did you have?
Now we've worked out what you've got.
Yeah,
and I had to have 3
before they acted.
3 kidney infarctions.
Ridiculous. Now,
with that clot could have landed obviously in the brain and became a stroke at that point in time. Lucky for me, it landed in my kidney. Sure, it's killed off most of my right kidney, but I've still got a good kidney. So I'd rather have that. I was lucky. But the fact that it had to happen 3 times over a 10-year gap, 3 times before they go, we really should spend some money and do an operation because you're going to die if we don't. It was the 4th time that I went in where I tried to drive myself into hospital because we couldn't afford an ambulance healthcare. I'm driving in intense pain. I had to leave you behind because we just moved. The stress of moving caused another blood clot and landed in, and that led to emergency surgery.
It was
they
awful.
protract, they prolong things because they don't want to spend the money, and it's your life. You only get one life, you only get one chance, and sometimes it can just happen where it's like, oh, maybe it did land in the wrong spot, and then that's it. You can't come back from there. So please be mindful of that conversation.
With this is, I just want to be honest with everyone, because I have watched channels with chronic illness, which, you know, in those days we used to call it chronic illness, and some of my illnesses come under that, and some
chronic
of it doesn't.
Long time,
But basically, I just want to say this is, I know what it's like to turn up to someone's channel and to see that they've died.
Yeah.
And it's a real thing in this community. And I have to be honest, because I want to say to you that, like, don't be sad. If that happens one day, I just want to prepare you for that, because I know what it's like to connect with others online in this way. And then you turn up and we all think so positively, and that's great. And keep doing that. But we all know, and some of you might have experienced the same thing, you turn up to their video and you go, oh gosh, they've been a long time. What? And then you look at the title or whatever and you go, what? That was their last video.
Or their
Someone's
parents have
released
posted
their
to
last
say
video.
this happened. And
Correct.
look, this happened not so long ago to a person in our local
in Perth.
Perth, using the same local hospital that we're having the same related issues to, with the same symptoms and conditions that Dyan has got, and she died of heart failure, and it was failed by that system. So we
she's 24.
have
24.
Again, it fits all the criteria of what
24.
we're talking about. It's like, you can't have a heart issue. You're not going to die of heart failure. You're only 24.
Because they don't understand EDS.
Yeah, correct.
She had EDS and gastroparesis. That's what we shared together.
Yeah.
And so I'm just saying, like, I do like to be honest and upfront. This is, you know,
the point of our channel. We're transparent, working through the good, the bad, and the ugly.
I don't need people to sort of be worried about that I don't think positive, or, you know, don't think so negative. Positive. Don't focus on these things. I have to, because you know why? I have to prepare myself.
Well, we have to be sensible.
I have to prepare myself at such a young age to face the fact that I have to act like I'm really old and get my affairs in order, basically.
And also be cautious.
I have to make sure that everything, and just trust me, when you get there one day, and everyone's different, everyone has a different timeline, but when you get there, you don't think the same way anymore.
Correct.
Your whole complete mindset changes.
Yeah.
And I notice there's a lot of pushback from family and doctors and people around you to stop that. Stop that. It's a process that I'm going through, and people try and stop it.
I know.
Please, if you've got a loved one that's fighting some battle similar to like
but don't give space for it.
Let them do whatever it is. Even if you think it's stupid, you just don't know when their last day is. Sometimes people, and it's well known in literature, people know when it's their time.
Correct.
They don't need to be told by a medical practitioner.
Well, it's well known in the animal world, don't they?
Yes.
Animals separate themselves from the herd in that preparation.
We're the same. And I always said to you, before I got diagnosis of 22q, before I got any other diagnosis, really, except for MECFS and maybe a few other things, I said to you, I'm not going to be an old lady. And you used to laugh at me because we were young. Yeah. And I said, I'm not going to be. And you're like, why do you keep saying that? I said, because I just know. No.
And when you've seen so many organs not do what they're meant to do, when parts of the body start failing, and like I said, Dyan's got a body and presentation of symptoms as if she is 80 or 90 years of age. And that's
I don't pick up the camera when I'm at my worst.
22q. And you don't.
I don't pick up the camera when I'm crying in pain for hours. I don't pick up the camera, you know. If I've got a migraine, that's just so intense. Or just going for so long that I'm so exhausted from the pain that all I'd bring is probably negativity if I actually spoke a word, because I'm feeling so miserable. Fevers that I battle and fight daily.
It's not comfortable being sick,
living like
guys.
I've got gastro all the time because my GI tract just doesn't work.
Or to have so many medications in that literally I shook her, she would rattle. Because there's so much that you have to do, so many accommodations, so much effort.
Sometimes I've cried at the morning meds because it's like I can't do this anymore.
Your pain scale starts here at the start of the day, so it's very easy to tip over. Guys, we really appreciate your time, your effort, your consideration consideration in
Thanks
watching
for
today's
listening.
episode.
I hope this has helped someone.
I hope
anyway,
so too. I hope it's created awareness, because unfortunately I'm really sick and tired of seeing
women as well.
Female health being so disregarded, particularly here in Australia. I'm sick of seeing the misogyny, the gaslighting. Firsthand, I've seen it firsthand.
Don't know the information.
And then it's like, well, when you then get the
advice,
diagnosis and treatment from other people, it's like you should go back and say, well, I told you so. Would you like to say sorry now?
And you know what? I've had two barristers, a human rights lawyer, and another lawyer tell me I've got a medical negligence case.
Yeah.
I just don't have the money
to fight
to
the
get it
government.
going. So, guys, you know, the world is there.
Yeah.
We are there. We are now no longer in a world where others, such as people in power, care about us average people.
No.
End of.
And look, unfortunately, with a lot of genetic conditions, the overall cost of care is one of the factors that come into their budgetary administration decisions.
Absolutely.
Now, that wouldn't be so bad if they actually did things appropriately, where if you identify early, intervene early, you don't have to deal with a lot of these things later on in life because you've got the right things set up. That's the consequences of failing early detection and getting onto the right path. Guys, we really appreciate you watching us. Big thumbs up of encouragement. Hype the channel, because that actually helps to create awareness in the algorithm. Don't forget to share us so other people who might relate, who might need to hear this story.
Anyone that needs this information, anyone that needs our type of
and as I said, your comments, questions, ideas and suggestions, leave them below, because Dyan would like some feedback from you in today's episode.
I would love some feedback on people that get this absolute like yearning to I don't know, like do certain things to leave behind, you know, whether it's writing a letter, whether it's doing a video and it's, you know, unlisted and it's ready for someone that you love.
Yep.
I go through these phases all the time of just this burning, and I keep pushing it away, like I'm being stupid, don't do that kind of stuff. But this is the problem. If obviously my gut's telling me I need to do something,
but this is actually part of the
let your loved one do that
journey. And if you actually, to again put into perspective, you've got a body who's showing symptoms of an 80 to 90-year-old. What do many 80 to 90-year-olds actually think about when they're aware that their time of life is coming to a conclusion? You think about putting your affairs in order. That's all part of it. Guys, if you haven't already, please subscribe, hit the notification bell.
Who's going to take my special clock?
Yeah. I've got
probably
the cats,
no one.
apparently.
Anyway, my sons and daughter-in-laws, like, I've got some cool shit, man.
She's got a lot of shit. All right, guys, we're going to love you.
See my clock.
And we're going to leave you. And we'll see you
nice clocks.
in another episode real soon.
Bye.
Bye for now.